Welcome. My name is MJ Schmidt. I am the Training and Outreach Coordinator for the Brain Injury Association of Pennsylvania. Today we'll be completing a training about 35 minutes in length on brain injury screening using the OSU-TBI-ID to identify those with history of brain injury. At the end of this training, we will share some information if you would like to receive a certificate for taking part in this training. In this training, we're going to talk a little bit about undiagnosed brain injury and highlight the importance of screening for history of brain injury, particularly in populations where it might be underidentified. We're going to highlight a few brain injury screening tools and focus in on one, the Ohio State University Traumatic Brain Injury Identification Form, modified to include non-traumatic causes of brain injury. We'll also see a demonstration of that tool being used. And finally, we'll talk about some resources for further information and/or assistance that you and your team might find useful on this subject. Finally, I want to acknowledge our funding source. This project was funded by the Pennsylvania Department of Health's Title V Maternal Child Health Services Block Grant. At the conclusion of this training, you should be able to describe a screening protocol for identifying individuals who have a history of brain injury, be able to describe and utilize the 3 steps of the OSU-TBI-ID modified, and recognize factors that contribute to a positive screening. Before we begin, it will be important for you to have a copy of the OSU-TBI-ID modified handy. It is available on our website, right where you access this training at the beginning, or it can be accessed by using this QR code. For those of you who aren't familiar with QR codes, simply point your camera from your phone to the box that you see on the screen, take a photo, and it'll link you directly to the PDF of the OSU-TBI-ID. Screening for history of brain injury is incredibly important, especially for professionals who are working with populations where we know brain injuries might be unidentified. On the next slide, we're going to go through a scenario thinking about an individual who's had many brain injuries which have been undiagnosed. Take a minute to just think about, as we go through the following slide, who might have identified the brain injuries. A young man in his mid-20s, hospitalized in a mental health unit, was admitted with the following complaint: "There's something wrong with my head and I can't keep a job." During clinical interview, he revealed that he had been physically abused as a child and subsequently hospitalized for broken bones. When he was school age, he was hit by a car, resulting in hospitalization for multiple injuries. He was placed in special education as he had trouble learning and controlling his behavior in class. As a teen, he began using drugs and alcohol. While still a teen, he was involved in another incident, resulting in hospitalization for several days. Thereafter, his ability to concentrate, remember, and control his temper became even worse. After high school, he enlisted in the National Guard and served in Iraq for several months. He was injured in an attack, later describing this experience as severe PTSD. Once he was back in the States, he could not keep a job. His use of drugs and alcohol escalated, and he was jailed for several offenses. He had nowhere to sleep except his car. A mental health crisis resulted in hospitalization. The clinician recognized the likelihood of traumatic brain injury. Neuropsychological testing revealed neurocognitive deficits consistent with brain injury. This young man was indeed a case of unidentified TBI. Once brain injury was identified as a contributing factor, he was linked to appropriate services and supports and was then able to move along with his life. So thinking about this scenario, when could brain injury have been recognized and by whom? Early on, we hear about an episode of child abuse resulting in hospitalization. Certainly an investigation or complete medical care, including a screening for this history, could have revealed brain injury. Similarly, there's a car accident as a child. Was there a screening? Did someone ask questions about dazing or loss of consciousness? The school district certainly did an evaluation for special education. I guess a question is whether or not they considered brain injury as a possibility and asked those similar kinds of questions. The National Guard, both in its enrolling of this individual, so was he screened before he enlisted, and after his injury, was he screened for brain injury? The prison system, is part of the intake for prison. Was this individual screened? And then finally, we have the mental health practitioner who does identify this likely history of brain injury. Beyond traumatic brain injury, there are other kinds of brain injuries that are also often unrecognized. In this video, we'll hear some information about brain injury as a result of overdose.
I've seen people who we woke up with Narcan and, they went to the hospital and they were discharged hours later, and then they went and did it again a couple hours after that. We've definitely had the same patient a couple times in a single 12-hour shift. And at that point, it's like, where's the disconnect? Where is that? It can't just all be this addiction aspect. There's got to be some sort of cognitive disconnect.
There is a cognitive disconnect. It begins when breathing stops.
An overdose, an opioid overdose in particular, suppresses the respiratory system, your breathing. And your breathing either slows down or stops to where the brain is not getting enough energy. It's not getting enough blood. So when you stop breathing, the brain stops getting the blood that it needs, and that causes you to lose consciousness. And we know that denying the brain of oxygen can very quickly turn into cell death.
The result is often brain injury, but it's a different kind of brain injury than most. The more common brain injury, traumatic brain injury, is caused by a blow to the head. This, called anoxic and hypoxic brain injury, happens when not enough oxygen reaches the brain. John Corrigan, a researcher on the topic, explains.
The thing to understand is that the brain is like a hog for oxygen in our body. I mean, for its small mass, the amount of oxygen it wants and needs to do what it does is way out of proportion. And so when while the whole body is being denied oxygen, the bigger users of oxygen are what are more likely to be affected. And in the brain itself then, some of the big users of oxygen are what will sustain the most damage. So we know that includes, for instance, the hippocampus, which is the part of the brain that's involved in creating new memories. We know that the cerebellum, which is in the back, and it's a big user, and it's very involved in balance and coordination. But we also know that some of the connections from the midbrain to the frontal areas are also affected disproportionately by the loss of oxygen. And so we get, with an opioid overdose, some of the same problems that are characteristic, that are kind of the fingerprint of a traumatic brain injury.
So now that we know there's a lot of brain injury that is not identified, how do we go about screening for that history of brain injury? Research indicates that the very best way for us to screen for a history of brain injury is to do a semi-structured interview where we literally ask an individual whether or not they've ever had events that are likely to cause brain injury. There are a number of structured interview instruments that can be used, and you'll see 4 of them listed on the screen. The Traumatic Brain Injury Questionnaire, the HELPS, the Ohio State University Traumatic Brain Injury Identification Form, and the Brain Injury Screening Questionnaire. We're going to focus in on the OSU-TBI-ID. This is a photograph of the OSU-TBI-ID that you should have downloaded at the start of this presentation. The OSU-TBI-ID can be administered by anyone who has a background in basic interviewing skills and some minimal training. It's a quick tool to administer. In the context of another interview, it takes no more than 10 minutes for most individuals to get through this screening. It's interpretable. So the OSU-TBI-ID has reliability and validity information, and it suggests on its backside what kind of events actually lead to that conclusion that, yes, this person is positive for a history of brain injury. And it's applicable and can be used widely in a variety of settings and with many different kinds of patients. So let's talk about the best way to conduct the screening. The OSU-TBI-ID is divided into 3 steps. You'll see, looking at the form that you downloaded, that the first step is a series of questions that gets at possible causes of brain injury. You'll see the instruction for you, the interview, in the black box under step 1. So you are going to record the cause of each reported injury and any details provided spontaneously in the chart at the bottom of the page. But you're going to be checking either yes or no to each of this series of 5 questions. The first one is, in your lifetime, have you ever been hospitalized or treated in an emergency room following an injury to your head or your neck? You can cue your interviewee to think about any childhood injuries they may have experienced, and then you're literally going to be checking either yes or no as to whether or not that's true, and if it is, you're going to add the cause to the right in the box under step 1. The next question in step 1 is about crashes. So here you're asking the individual if across their lifetime they have ever injured their head or their neck in a car accident or from crashing any other kind of moving vehicle. Could be a bicycle, a motorcycle, an ATV, and you can provide this prompting to the individual. And again, you're going to go under step 1 in the center of that form and indicate yes or no under the question, and then write the cause in on the chart. Question 3 under step 1 gets at what we might call struck by or against injuries. So here we're asking whether or not someone was ever injured their head or their neck in a fall, or by being hit by something, or through sports, or on the playground. And again, you're going to record yes or no to the question and then record the cause in the chart. Question 4 asks about fights and violent events. So in your lifetime, have you ever injured your head or your neck in a fight from being hit by someone or from being shaken violently? You also ask if they have ever been shot in the head. And again, you record yes or no to the question and then record the cause in the chart. The final question in step 1 is about blasts. In your lifetime, have you ever been nearby when an explosion or blast occurred? If you served in the military, think about any combat or training related incidents. And again, you're recording no or yes to the question and then putting the cause in the chart. Step 2 of the OSU-TBI-ID is the place where we are going to quantify some information around the individual's alteration of consciousness. We're going to find out whether or not they were knocked out or actually lost consciousness, and if so, we're going to quantify that. Was it for less than 30 minutes? Was it between 30 minutes and 24 hours, or was it greater than 24 hours? If they didn't lose consciousness, were they dazed, or did they have a gap in their memory around the injury? We're going to record either yes or no for that. And then finally, for each episode, we're going to want to quantify how old they were when that event happened. Step 3 of the OSU is a unique feature to this screening tool. This question has to do with whether or not the individual you're screening has a history of events that were multiple and repeated to their head. Examples here might be someone who has a history of abuse, played football, was a boxer, served in the military. So we're going to ask them whether or not they have ever had a period of time in their life where they experienced multiple repeated impacts to their head. You can give them some examples. If they say yes, we want to find out what the typical and most severe effect in terms of their alteration of consciousness was. So, typically, were they dazed or did they lose consciousness? And then at the most severe, what was the most severe episode they can remember? Were they dazed or did they lose consciousness? And then to quantify that loss of consciousness. And then finally, and very importantly, we want to determine the age range during which these impacts were happening. So at what age did it start and at what age did it end? The OSU-TBI-ID was originally developed to screen for history of traumatic brain injury, but we know that there are a lot of other causes of brain injury, non-traumatic causes. In fact, we looked at the video earlier about the intersection between opioid misuse and brain injury, and that anoxic or hypoxic brain injury. And so this tool that we're describing today is modified to include not only those hypoxic and anoxic events, but other non-traumatic causes of brain injury. Things like strokes, aneurysms, electrocutions, infections, brain surgeries and brain tumors, epilepsy, and other toxic exposures. On the second page or the back of the OSU-TBI-ID form, you will see a box entitled Other Illnesses/Medical Problems that gets at those non-traumatic causes of brain injury. You're to ask the participant this series of questions and then answer yes or no to each of those, recording also the age at which any event reported happened. The first question is this: have you ever been told that you had a stroke or bleeding in your brain? Other words you might have heard are a ruptured aneurysm or an infarct. So again, you ask the question, you indicate whether or not the individual had that experience, and if so, at what age it happened. Question 2 under the non-traumatic causes gets at the issue of insufficient oxygen to brain. The question reads, have you ever been told that you had a loss of oxygen to the brain? This could result from losing consciousness or passing out after a drug overdose, strangulation, near drowning, heart attack, insufficient respiration or breathing being stopped, the inability to wake up after a medical procedure, excessive blood loss, an example here might be a gunshot wound, or complications of anesthesia. Again, you record the answer from the individual, whether it is yes or no, and the age at which any event occurred. The third question under non-traumatic causes asks, have you ever been electrocuted or struck by lightning? Here we're looking for a severe event, one that blew someone back from perhaps the fuse box or caused them to be dazed or knocked out. And again, we're going to answer yes or no, and then get the age at which the event occurred. The fourth question asks about infections. Have you ever had an infection in your brain? You would have heard the words meningitis or encephalitis. Again, yes or no, and then if the individual has had that history, the age at which it occurred. Question 5 asks whether or not the individual ever had a tumor in their brain. Again, they answer yes or no, and we record the age at which the event happened, if in fact there was an event. In question 6, we ask, have you ever had a brain surgery? It could have been for epilepsy, the placement of a shunt, for a brain bleed, or for removal of a tumor. If any of that is true, the individual answers yes. We find out the age at which it happened. In question 7, we're asking about poisoning or toxic hazards. We ask, have you ever been exposed to toxic hazards? This could result from exposure to lead, mercury, uranium or radiation, environmental hazards, or carbon monoxide. Again, we're going to record whether the answer was yes or no, and the age at which any event might have happened. The last question under non-traumatic causes is, have you ever had seizures or been told that you have epilepsy? Record the answer either yes or no, and of course, if the individual does have that history, you want to record the age at which either the diagnosis happened or they had a seizure. As I mentioned earlier, the OSU is interpretable. The form itself offers guidelines for determining whether or not a history would be considered a positive screening, meaning that the person that we screened has a history of events likely to have caused a brain injury. We find the interpretation guidelines on the very back of the OSU or the second page, depending on how you downloaded it. So let's talk about interpreting the OSU. From the data that John Corrigan has collected, we know that an individual is more likely to have ongoing problems if they have any of the following. So you'll see these listed on that interpreting findings section of the back page of the OSU. The first one is worst. So if any of the injuries that were reported were either moderate to severe traumatic brain injuries, meaning that the individual has lost consciousness for 30 minutes or greater, we're going to be marking yes, and that would be a positive screen. The next category that we're going to look at are first loss of consciousness. So we're looking for whether or not the individual ever experienced a traumatic brain injury with a loss of consciousness before the age of 20. And if in fact that is true, we're also going to be checking yes, and that's going to be a positive screen. The next category is multiple. Here we're looking at whether or not individual had several traumatic brain injuries close together in time, 3 across their lifetime, or a period of time when they had those multiple blows to the head, repetitive blows to the head that we talked about in step 3, the kinds of blows that come from perhaps boxing or child abuse. If the individual has yes to any of those questions, we are going to be considering this a positive screen. And then finally, we're going to move to those other sources of brain injury, the non-traumatic causes. And so you'll look down the list of 8 questions that you recorded answers to. And if you find yes to any of those, again, you're going to mark that, and that would be considered a positive screen. So an individual doesn't need all of these in order to screen positive, but just any one category where we're checking yes means that they are more likely to have ongoing problems and that probably some secondary assessment is required. On the next slide, we're going to see a demonstration of a screening using the OSU-TBI-ID. This demonstration is done by myself and a colleague of mine, Tara DiGiulio, on Zoom. Obviously, it is not typical for screenings to be done on Zoom. Usually they're done within the context of your intake process and evaluation of a client. So they're done, in person across the table from one another. Hopefully this demonstration will give you a picture of the conversational nature that the OSU can take and provide you some food for thought as how you might employ it in your practice.
So Christy, for the next part of this interview, I'm going to ask you some questions about injuries that you might have had either to your head or to your neck.
Okay.
Just going to be a series of questions, and I want you to think about whether or not any of these things happened at any point across your lifetime.
Okay.
So first, have you ever been treated in the emergency room or hospital following an injury to your head or your neck?
I was in a car accident and went to the hospital. I was like 16. Does that count?
Yeah. What happened?
My boyfriend was driving and he was driving way too fast as usual. And he went around a curve and we hit a pole. The engine came into the car, like on our laps. And it hit me in like, I don't know, it had to hit me in my jaw. I broke my jaw and my hip.
Wow, pretty serious accident.
I lost a few teeth. These ones are all fake.
Oh my goodness. Were you knocked unconscious, Christy?
Yeah, I guess for a few minutes. I woke up when we were like just pulling up at the hospital in the ambulance.
Wow. One of the things I look at as I'm filling out my form in front of me is how long you were unconscious. And I have to decide whether it was less than 30 minutes or greater. Would you say this was less than or greater?
Less than, because the hospital wasn't really far from where we were. And I was waking up when we were getting there.
Okay. Any other times that you were treated in the hospital for an injury to your head or your neck?
No.
Any other kinds of crashes that you were involved in that you injured your head or your neck? So a car accident like this one, any more of those, or a dirt bike, a bicycle, motorcycle?
No, I've never been on any of those.
The next question that I am going to ask you has to do with a couple of different kinds of injuries, but all of them involve either you being struck in the head or the neck, or being hit in the head and the neck. All right. So ever have a fall where you injured your head or your neck?
Like off of
Like-
something?
Yeah, like falling on ice and hitting your head might be an example.
No, I've never fallen and hit my head. No.
Okay. How about being hit in the head with something like a rock, a stick, a bat?
No.
And how about any sports injuries where you injured your head or your neck?
No, I didn't play sports.
The next question has to do with fights. Have you ever injured your head or your neck in a fight, or by being hit by somebody, or by being shaken violently?
I've been in a few fights in my life. My teenage years were rough. I remember at least one fight that I got knocked out in high school.
So how old would you say you were?
I was a senior, so probably like 17.
And you said you were knocked out?
Well, I mean, she knocked me down. But I got back up to defend myself. So I don't think I lost. Like I remember it.
How about, did you feel dazed or woozy? Any of those feelings after being hit?
There were a few scars. Yeah.
Okay. Any other fights that you can remember where you had that kind of woozy feeling or were knocked out?
No, that was probably the worst one.
Were you ever shot in the head, Christy?
No.
And this last question has to do with blasts. Were you ever exposed to an explosion of any sort? It could be a firework or a bomb, that you were close enough that it actually created a feeling in you of confusion or even propelling you backwards, anything like that?
No.
Moving on, we're going to talk about whether or not you ever had a period of time in your life where you had repetitive blows to your head. So sometimes when I'm talking about this, I think a really good example might be someone who was a boxer. So they might have been in a lot of fights, but they can't say to me, oh, there was this fight and that fight, but they just know that they got hit in the head an awful lot and that sometimes they got a little woozy during that. Do you have anything like boxing? I know you said no sports. Football could be an example, or being maybe in an abusive relationship where this might have happened to you.
Yeah, I was in a couple of abusive relationships where I got like hit or punched. I have bad headaches now, even into my adulthood, that I don't know if that's what it's from, but yeah.
Do you remember episodes that caused you to either be knocked out or to be dazed?
I was choked out once. Does that count?
Yeah, tell me about that.
He just had his hands around my neck and we were fighting. He was yelling and I There's a few minutes that I just don't remember.
But you know that you passed out.
Yeah.
And how old were you when that happened?
I just graduated high school, so I was like 18.
And how long would you say this time period is during which you were being involved in this relationship and being hit?
It was the whole time. I kept trying to leave, but we broke up when I was like 26 is when I finally got away. So like 8 years.
So 18 to 26.
Yeah.
Okay. Well, thank you for sharing that with me. The next series of questions that I'm going to ask are about medical conditions that also can affect your brain health. Not always, but sometimes.
Okay.
So have you ever been told that you had a stroke or bleeding in your brain?
No.
It could also be something like an aneurysm or a ruptured aneurysm, an infarct. No.
No.
We just talked a little bit about the choking episode or being choked out. And that's something that I would consider to fit in this next category where you have a lack of oxygen to brain for a period of time. Any other times where you had a strangulation of any sort?
No.
How about any kind of near drowning where you found unresponsive in water, for example?
No, I'm a pretty good swimmer.
Okay. The next one is about overdoses, being found unresponsive after a substance. I know that you're here now for treatment of your addiction. Have you ever been overdosed and found?
Twice. When I first started using after my relationship ended, I overdosed at like, I don't know, I was probably like 30. They took me to the ER and I ended up in a rehab for 30 days then. It obviously didn't work, but that was the first time.
And so someone found you unresponsive.
Yeah. The police.
And then more recently?
Yeah, that's how I ended up here. They use Narcan, at least that's what they say. I don't remember honestly. But I guess I went to, after the Narcan, they took me to the hospital and then I came here.
Ever have any difficulty waking up after a medical procedure or anesthesia?
No, I never had any surgeries.
Okay. And no heart attack ever?
No.
Christy, have you ever been electrocuted or struck by lightning?
No, I guess I'm lucky there.
There you go. How about an infection in your brain like meningitis or encephalitis?
No.
Have you ever had a tumor in your brain or brain surgery?
No tumors that I know of.
And no surgeries ever to your head?
No.
Have you ever been exposed to a toxic hazard? So here I'm thinking about lead or mercury poisoning.
I mean, I grew up in old buildings in Philadelphia.
But you were never diagnosed with this as a kid in school, anything like that?
No, no. Mm-mm.
How about chemotherapy or radiation?
No.
Exposure to pesticides or poisons?
Not that I know of.
And how about carbon monoxide poisoning?
That little buzzer that goes off in your house? No.
Okay. And then this is the final question. Have you ever had seizures or been told that you had epilepsy?
No.
Great. Well, we're going to use the information that I gathered here as part of your intake. We always want to know about your history of head injury because it can impact on the next steps that we're going to recommend for treatment. Any questions for me?
No, is it bad?
No, it's not bad. It's really important information for us to have so that we can do our treatment planning so we get a holistic picture and we can address all of the issues that, you came here to get addressed.
Okay, thank you.
You're welcome.
So Christy's screening is positive. If you look at our interpreting guides, you see those pasted to the right on the slide. She is positive for 3 possible causes. So she has a first loss of consciousness before the age of 20 in the car crash. She has that history of repetitive blows to the head that we discover in step 3 when she talks about her history of being involved in a relationship with someone who was abusive. And then she has a couple of different non-traumatic causes, both related to insufficient oxygen to brain. She talks about being strangled and choked out, as well as 2 overdoses related to her opioid use. And so, as you'll see at the bottom there, her outcome is positive for history of brain injury. So what's the next step after a positive screen? What does it mean? Not all episodes of brain injury lead to cognitive impairment. We all bang our heads or have episodes where maybe we get dazed, and yet most of us don't ever experience any permanent effects. But there are episode characteristics associated with a greater likelihood of long-lasting effects, and those are the interpretation guidelines from the OSU. What we can do as practitioners to take it to the next level and determine whether or not somebody has impairment is really do a next level assessment. There are a couple of examples here listed on the slide. One is a symptom checklist, simply a self-report measure where you're asking someone about functional problems they might have in their day-to-day life. And the other is standardized testing, neurocognitive testing, neuropsychological testing. You can look for another asynchronous learning option for you to learn more about both of those options on our website. Understanding your client's history of potential brain injury is really very important. It's a critical variable when you're doing your treatment planning. Brain injury can impact on an individual's capacity to use the treatment that they're provided. We know that the common problems associated with brain injury impact on a person's ability to attend to process, to remember, and to use or apply the treatment that they're given. It also can impact on their level of self-awareness or insight and their ability to regulate their emotions. And that the problems that come from brain injury come from an organic place. The brain is an organ, so the problems are physical. They're not willful. The other reason that it's really important is that there are interventions and resources that can be effective. And it's critical that we connect the individuals with these histories to the appropriate stream of care. This wraps up our brief introduction to screening. We certainly are appreciative of your being here with us. We know that some of you may want to know more, and we can help. So the Pennsylvania Department of Health has a grant which offers training to professionals working in substance abuse settings or other places where they're likely to come in contact with individuals with brain injury, as well as technical assistance or consultation to organizations who are interested in taking the information we've talked about and developing protocols to identify individuals with history of brain injury within their care. There are several other asynchronous training programs available on our website. The next one is on how to assess neurocognitive challenges, one on ways to adapt treatment for individuals with neurocognitive challenges, and one on brain injury resources. We hope that you'll check them out. If you would like a certificate of attendance for taking this training, please either scan the QR code that you see on the slide or visit this link to fill out a brief form and get a general certificate of attendance. This will also allow you to receive BIAPA's monthly newsletter. If you're interested in learning more, contact Monica Vaccaro. She is the Brain Injury Association of Pennsylvania's Director of Programs, and her email is here on the slide, vaccaro@biapa.org.